So, for the next 30 minutes, we're going to talk about summative assessment. Here's what we're going to accomplish. First, I'm going to tell you what summative assessment is, try to get that across, why it's important, and then we're going to talk about how do you deliver oral and written summative assessment. What we're not covering is how to design evaluations within your program. So how to deliver and how to evaluate residents on that scale. If you have questions on that, we can talk about that afterwards. All right, so first I need to know a little bit about who is here so I can get a feeling for that. So who over the last year or the next year will be teaching medical students? Raise your hands. Pretty much everybody. Residents, most, and then what about fellows? Okay. Any other learners that you'd be teaching over the next year? All right, so mainly medical students, but also residents and some fellows. Fantastic. All right, so as clinical educators, we all have a lot of roles. We wear a lot of hats, right? I mean, think about the things when you're on rounds that you're trying to do. You're trying to diagnose the patient, you're trying to diagnose the learner, you're being perhaps an administrator, you're in charge of doing scholarly activity, all of these things. And one of our roles is evaluating residents. Now, who here has evaluation as their most favorite part of their job, where they just love evaluation? That's what I thought, right? So it's not the part that just gives us the warm fuzzy inside. I mean, it's not often that I go home and I say to my wife, you know, today I just gave such a great evaluation. I mean, I just felt so good about that, right? We love it, but it can be really helpful, and if we learn to do it right, I think it can be a very valuable skill that can be fulfilling. All right, so first off, let's just try to think about feedback versus evaluation, because it took me a while to kind of separate these in my head, and quite honestly, sometimes I still call evaluation feedback and vice versa. So what are we talking about? So feedback is what we just spent some time learning about. That's formative assessment. So it's getting a learner to a goal, helping them along the way, coaching them. This is what we need to do to move you to the next step. What we're talking about here, which I would call evaluation, is summative assessment. So this is at the end of the rotation, at the end of our time together, this is how well you did. And this is how you did compared to what is expected of someone of your stage, and this is where you are. Tests tend to be summative assessments, right? You think about the boards, you've completed your residency or fellowship, and then you take an exam that tells you how well you accomplished the goals that you set out to accomplish. So this is what we're talking about. Feedback is non-judgmental. It presents information. I noticed that you forgot to mention the social history, and then it allows the learner to respond. Summative assessment is a judgment. It's a judgment, in our experience, this is where you are compared to where you should be at this stage. Okay? Feedback, we've talked about, we want to have it very timely, right? So you wouldn't say, 2 weeks ago I noticed that you missed the social history on that presentation that you did. That wouldn't work. We need to give it in the moment to coach. Whereas summative assessment is typically at the end of our time together or halfway through a rotation with a learner. It's typically more formal, so it's not on the fly, it's not typically with a lot of other learners involved. It's formal, it's sit down, and the scope is global. So as opposed to only one specific thing, this is how you're doing overall. Now we're going to back it up with specifics, but we're giving a global assessment. And feedback, the goal is performance, improvement, whereas evaluation, the goal is advancement, but I would also say it's for improvement. So in my mind, evaluation is important because we're going to do three things. We're going to give the learner insight into where they are compared to where they should be. Are you behind the curve? Are you right on the curve? Or are you ahead of the curve? We're going to give the learner's programming information on where they should be, right? So this is someone that needs extra attention, or this is someone that needs to be challenged because they're ahead of where they need to be. And then we're going to give advice to the learner on how to improve. And this is something that I think we all as clinical educators can feel really good about. We helped a learner improve and get to the next stage. And so in that part, I think we can get excited about evaluation. Miller's Pyramid of Assessment. Have y'all seen this before? Okay, so we know that on the bottom is nose, And that is a multiple choice test on a very specific exam question. We often think of tests as the end-all be-all of evaluation or assessment, but really in Miller's Pyramid, this is on the bottom. What we're evaluating with our clinical learners is what does a learner actually do? Whether they knew to do it or not, what did they actually show us? How did they perform in the moment? And I would argue that that's more important than whether they knew to do it or not. What did they actually do? All right, so we're going to talk about next how to give oral and written summative evaluations or assessments. So how often at the end of a rotation, so you have your learner for 2 weeks or a month or whatever it is, you're parting ways, do you sit down one-on-one or stand up one-on-one and give an assessment to that learner of how they did during your time together? So, and just a show of hands, who does this every single time? They never miss it. All the time they give a evaluation or assessment. Okay? What about most of the time? Okay, I'm going to add a some of the time in there, some of the time. Okay? Rarely. Okay? And never. Okay, all right. So what I'm going to try to do is convince those that are here in the sum of the time about how you can get to here and here, why it's important, and how to do it well. For those of you that aren't doing it a lot, would you care to talk to the group about maybe why? Is it time? Is it perceived? I don't think it's useful. I don't think it's valuable. Or is it that hasn't really been an expectation of me as a clinical instructor? Does anybody want to give their thoughts?
I'll share on behalf of people who I've coached to do this. They say there's a little bit of personal discomfort, and then they don't feel it's an expectation. So here I'm thinking of maybe senior residents that are supervising interns or medical students on a team. They're like, well, I'm a resident, I'm their peer. It's only their attending that should be giving them
someone else
should be doing
it. The program director should tell them how they're doing it, not me. One thing I've heard is they know how they're doing. It's obvious that they are, like look at everybody else, look at their face when they present. They're not, they know how they're doing. Right? Does anyone else have any thoughts on that?
One thing is short duration of exposure. So if you're on a consult service for several attendings were attended throughout the month, they might have only had 4 or 5 days.
Right.
I felt like they could give an evaluation.
Yeah. And I would say that if you have a learner for too short of a time where you don't think you can assess them fully, that's an appropriate time to maybe not give a big assessment unless you saw some specific things that you can. And I have certainly, I had some medical students that I worked with for just 3 days, and I got their evaluations, and I sent a note back to the clerkship director. I don't feel like I can tell you if they're an honors student or not in 3 days. I would like to decline doing these evaluations. Because it wasn't fair to the student. They didn't have enough time. And so I think that's a great thing. All right. So let's talk about why to evaluate. So I think that, all of our learners are on this continuum somewhere where they start and then they have to get better at different points and they hit these milestones. And then the end goal is that they do what we do, right? That they know how to take care of patients and do it well. The reason to evaluate is to let that learner know where they are. Because if they're 2 months away from graduating and they're here, that's a problem. And we want to let them know that early, not right when they graduate. So we want to tell them where they are. If they're 3 months in and they're here, they need to know that so that they can go to the next level. They can push themselves to do additional things in their residency or fellowship. And so we really want to provide that insight to the learner, insight to the program, and give advice to the learner. And we're going to talk about how to do that without that kind of awkwardness, right? Because it can just get downright awkward sometimes. All right, so who, let's say you're going to have that talk at the end. You've worked, let's say, with a resident for 2 weeks on wards, and you're going to talk to them and give them your assessment and your evaluation. How do you do that? How does that conversation go? And I'd like to hear a couple different people say what their approach to that conversation is. Yeah.
I keep it really broad and just say, tell me how things are going, what's going well, and what do you think could go better?
So you start with a question to them about how they are doing, how they perceive how they're doing. Okay. Do others do that? Do others start with anything different? Yeah.
Yeah, I do the same thing.
Okay. Fantastic. Yeah.
I start by setting up the situation, saying that this is an open conversation where we're going to do feedback.
Okay.
That way the other person knows that it's actually time for feedback and there's no misconception.
Right, and so there is a statistical difference in whether the learner thinks that they got feedback on whether or not you said the word feedback or not. So even if you're giving them evaluation, I would encourage you to say, I'm giving you feedback. Because when they go to evaluate you, they will check yes if they were told that they were getting feedback from you. Whereas if you give them feedback and don't label it, they may not know that they got feedback. So I would encourage that. But I like that, setting up the ground rules, saying this is an open conversation, I want your thoughts, I want your opinions, and then asking the learner to self-assess. Similar to the way we did in the feedback coaching model, right? Ask first the learner to self-assess. Where do you move the conversation after that? So the learner kind of gives you, they talk around, they say how they thought things went. What do you do after that?
Validate where they have an accurate self-assessment and nudge where they don't have an accurate self-assessment.
Okay. So I heard you. These are the things that I heard. This is where I think you're right on,
yeah.
and this is where I think you could get some improvement. Okay? Other thoughts on how you handle that conversation? Yeah.
I usually ask them to express what's positive in their rotation, what's negative in their rotation, what has changed if I worked with them before.
Okay, so that's excellent, especially if you have a learner you've worked with multiple times, and you can give that perspective of, wow, I remember when it was your second month of intern year, and your main concern was where the bathroom was. Now, look at you, handling patients on your own. You've really grown. That's fantastic. Other thoughts around this conversation? Yeah.
I would usually start with asking them how they thought the rotation went, and then what did they learn?
Mm-hmm.
You tell me what you learned, the most important things. And that could be cognitive, but it could also be behavioral, skill sets, whatever. Open that up, and you'll find out usually where they think their strengths are. They will mention where the weaknesses are.
Right. And what did you learn is helpful to give you insight into what was taught well during the rotation, right? Because if you think you gave everyone on the team has a newfound appreciation for how to approach the patient with chest pain, and they talk about they learned how to discharge people faster, it lets you know where they were and kind of what they appreciated from the evaluation. So I think that's a great way to do it. And the other thing that I would ask along that lines of, what have you worked on during this time? What have you improved in? And what are you still working to improve? And trying to give them, to get them to assess where they are before you provide your evaluation. So I agree with you. This is the way that I approach the oral evaluation process. The first thing I do is to ask the learner to self-evaluate. And I'm not really sure how to give an evaluation if I can't do this part. And it's similar to evaluating their clinical reasoning or anything else. If the learner doesn't commit to where they think they are, I'm not sure how to approach them. Because if you have the learner that's performing down here, and they say, I think everything went well, I had a great time, then that lets me know, wow, they're clueless. But if I have a learner you'll also have the learner that's a very high performer, and how do you think you did? And they'll perseverate on 10 different things that they did poorly over the month instead of the 1,000 things that they did really well. And so asking the learner to self-evaluate, I find the most helpful part of the oral evaluation process. The other thing that I like to do is talk to the resident first, because I ask them to self-evaluate themselves, and then I ask them to give me their insight into how the interns and the students did. Because I might be with the team for 2 hours a day, but the residents with the team for much, much longer. So they can give me a lot of insight into who was really helpful, who was not as helpful, who was really engaged, who was leaving early, that sort of thing. And then that's really helpful for the next set of evaluations that I do. So asking the resident first. And then I give my evaluation and my assessment. And so this is really my judgment of where the learner is on their path. I really want to focus on two main things. What did they do well? What should they keep doing with specifics? And then what can they improve on and what they can do better? I try to take an idea of what their expectations were at the beginning and incorporate that in. So at the beginning, when I'm setting expectations with the team, I ask them what they want to work on, what they want to improve. So I'll say, remember at the beginning how you said you wanted to improve your presentations. This is what I saw you do really well. This is what I think you need to do to improve it and take it to the next level. And I find that if I focus on the things that they themselves identified, it's much better received, right, than if I focus on something else. Now for the things that they didn't identify but are really important, I then have to emphasize why those things are important and talk to them about how they could do them better. So we're giving a global evaluation, but the more specifics I can give, the better. So here's where you are, but here's specifically what you did, and here's specifically how you can get better. And I try to be nice, but I really try to be honest. And this is where, I think you have to, take we want everybody to get along and everybody gets an A hat off, and think about what's important to the learner. So I was giving an evaluation to a medical student last week, and I said, Michael, during the first 2 days of the rotation, I wasn't really sure if you were interested at all in what we were doing on the team on rounds at all. You seemed kind of aloof. You were looking off during the presentations. You didn't come into the patient rooms on some of those times. And I wasn't really sure if you were engaged at all. Now, during the last week that we've been together, that's really changed. I've seen you be much more engaged, much more excited about medicine. Tell me what your thoughts are on that. And so that was what I would say, nice but honest. I mean, that's a big thing to say, but I thought it was important. And he said, I've been told that before. And that's what I find. Whenever I'm saying, how do I get the courage up to tell a learner something? It's something that they've been told before generally. And he said, in fact, my worst evaluations have been when I've worked with an attending for 2 days. And I get crushed on the evaluation every time I work with an attending for 2 days. And then so we were able to talk about ways that we could improve on that. For deficiencies, it's really important to stress why something is important. Because often the learner may be aware of the deficiency, but they don't think that it's important to address it. And if you just tell them the what without the why, they will often take offense to it. So an example I had, we were talking about feedback with a learner one time, so she was a resident. She said, I got the worst feedback from an attending one time. He told me during presentations, I was twiddling my hair and I just stopped doing that. And that was just uncalled for. I can't believe why the attending would just focus on that. I was giving great presentations. So that was the what without the why. If the attending would have said, look, you're doing such a great job on this rotation. Your presentations are spot on. But I'm concerned that some attendings you work with in the future may think it's unprofessional if you're twiddling your hair constantly while you're presenting. And I worry that they might get the wrong impression about you. Because I know you're such a hard-working individual, and I don't want you to come off that way. Then it's, I have the why, and I have this person that's concerned about me, and they're trying to help me, as opposed to, I don't understand why they would criticize that. So if it's something that you want the learner to really change, you have to emphasize the why. Why is it important? If you can stress their future career plan, that is a great way to do this. So think about your third-year resident or your third-year fellow. What are they going to be doing next year, and how could this behavior impact them, right? So I noticed that your consult notes were constantly coming in late, and you were prioritizing a lot of things before them. Next year, when you're out on your own in private practice, a big driver of your repeat referrals are going to come from getting those consult notes in really early. And that's going to be really crucial for you to do. So I'm worried that if you keep that pattern, you're not going to get the business that you need to get. So it's focused on the learner. It's taking it to what do they need to do on that next step or that next level. The other thing that you can do is talk about the attending that's coming on next, right? So I know that you've worked so hard on your presentations and you've made so much progress. Here's what I want you to do for Dr. Such and Such, because I know that Dr. Such and Such is going to be focused on this. Whether you know that or not, you just say it, and then you tell them what to do. Because when anyone is evaluating you and doing an evaluation, they're asking one main question that's going to decide how they feel about you. What is that question? Do they care? So when a patient is evaluating a doctor, you could have given them the wrong diagnosis. You could have led to improper care at terrible expense. And if they think you care about them, they will give you a high mark every single time. And if you gave them the worst care, but you care about them, that doctor cares about me, you will get great patient satisfaction scores. If they don't think you care, it doesn't matter how good of a job you did, you'll get a bad score. It's the same thing with students. If they think you care about them, you can give them a terrible evaluation. You can say you are here and you should be here. But if you're coaching them and you care about them, they'll think that you're on your side, their side, because you are. All right, so we have a lot of people that teach medical students, and so there's several different frameworks that you can use to assess a learner. I'd like to talk about the Rhine framework for a minute. Who here uses the Rhine framework or is familiar with the Rhine framework? No, okay. So instead of me going over it, let's just talk about that for a minute. How do you use it? Do you find it successful? Do you find it helpful? Or are there parts of the Rhine framework that you struggle with?
I think it works. My trouble with it is that it's not discriminating enough, so that I'm a program director, so I really focus a lot on residents, and there's so much within the manager that I can't differentiate someone who can manage very simple, uncomplicated cases from very advanced, complex, multi-system, undifferentiated problems.
I would agree. So I have found this framework most helpful for medical students because that's where they're in that reporter, interpreter, some of them are in manager stage. Has anyone here found it really helpful for residents? Maybe they're doing it better than I am.
I think one thing that residents might tend to forget, because the medical students present a lot of the patients, is you have to still be a very good reporter to be a manager or an educator. You can't just lose that skill. So sometimes later in residency, the third-year resident their presentation skills will erode. In clinic in particular is where it seems to be most noticeable. And they're so focused on the management of the patient. So I think that making sure that if you're going to use it, that your learners understand that that's a core principle of the framework, is they have to still be a very good reporter and interpreter.
And sometimes, if you have a higher performing learner, they might even take offense to say, oh, I know how to do reporter. Why? I don't need to show my work. I know how to do this math. Why do I have to show my work, right? Same kind of idea. So one of the things that you can do is talk to them about the importance of them being a role model to the other learners on the team. And I know you know how to present, but I want you to do the perfect presentation so that little Billy here can learn from you. And so that can be a way to make sure that you have a reason for them to do that kind of standardized formal presentation, which I find much more helpful. I like this framework a lot for my medical students, especially because it gives me a framework to say, where are you compared to where you should be? This is a slide from Stanford, and they have their presentations broken down where during the core clerkships, they expect their students to be building their interpreter skills and the sub-I be a manager. And so I can say, look, this is where I have seen you be an excellent interpreter or be a reporter, but I haven't seen you be a manager. And it gives me a way to discuss with them whether they deserve honors or not, where they're performing compared to where they should be. And this is something that the students can really understand because it makes sense to them. My presentations, that's my reporter. My synthesis of the data and my differential, that's my interpreter. And my plan for what to do for the patient, that's my manager. And I think it has a lot of face validity, and I can go over it with them, and I can They kind of recognize where they are. And so I can give them that expectation and say, in order to get to the next level, this is where you need to be moving, and this is what you need to be doing. So you can get honors from Dr. Such and Such, because I want that for you. I know you can do it. I'm going to coach you to that. All right. So after we've asked the learner to self-evaluate, given the evaluation, then we want to give advice for the improvement. And I think if we take that coaching framework, then it won't be poorly received. If we talk to them in terms of what I want for you is I want for you to just nail the next rotation, and I want you to just have, really improve it, and this is what I want you to do so you can really be successful. Then it's looked on very positively, as opposed to you just nitpicking or just wanting to find something that they didn't do well. So give tips for success on future rotations. Have those career goals in mind whenever you're giving the advice, and appeal to the learner's ideal best self. I know that you are a very bright individual who wants to know more about every single patient you admit. And so that's why the way that I want you to read about patients for the next 3 weeks is this, because I know that that's what you want, that's where your heart is. So you kind of appeal to their best self, and it can help it be better received. And then if a growth mindset is needed, work to instill that. So Carol Dweck talks about 2 different mindsets, mainly in children, the growth mindset or the fixed mindset, but this comes into play with our learners too. The learner with the growth mindset says, however I did is really a function of how hard I worked to get there. Where the learner with the fixed mindset says, however I did is just if I'm good at it or not good at it, and it can't be changed. So we go back to Michael, who I was giving that honest, but I hope nice feedback to, saying he was disinterested and disengaged during the rotation. And his response to me was, I said, why do you think that is, that when you work with an attending for just 2 days, they come off with this negative impression of you? And he said, well, that's just the way I am. That's just me. But once I get comfortable, then I do fine. And he said, and I said, well, I would disagree with you. I think you can change that, because you've shown me you're a very bright, motivated individual, and I bet if you set your mind to it, from now on, any attending you work with for 2 days could have a positive impression of you. Let's talk about how. And so we've talked about the specific things he could do with his body language to show enthusiasm and to show that he was interested. And he said, it's interesting, he said, the reason I'm like that during the first 2 days is because I'm trying to figure out what the attending wants, and I don't want to do anything that they don't want, but then they always just want me to be enthusiastic, and then I do that, and then I'm fine. And so he reflected on that as we were going through it. So I said, okay, you have a new attending, Dr. Huddle, coming on. What are you going to do in the first 2 days of rotation to make sure he doesn't get that impression? And we went through specific concrete behaviors that he could do to really help him out. So that was part of instilling a growth mindset. This is not just the way Michael is. This is something that if he sets his mind to, he can change. So that's the process, and it's similar to the feedback process. It's similar to ask the learner to self-evaluate, give the evaluation, and give advice for improvement. Now you have to do your written evaluation, right? So you get that written evaluation, you have to fill out the comments. But when you've done a really good oral feedback or evaluation session, now you have things to put there that are specific that you've already discussed. And one of my rules of thumb is I never put anything in the written evaluation that I haven't discussed with the learner. Because nothing will make a learner mad more than getting something on the written evaluation that's negative, and then they're thinking in their mind, well, if he or she would have just told me that, I could have fixed it. So I always try to tell them first. So we want to communicate to the learner's program, and it reminds the learner, oh yeah, I had that conversation. This is what I should be working on. And we want to get beyond those doing well needs to read more. Now we can give specifics because we've had that discussion about specifics with patients. And Calvin had the notebook up there, so this is my notebook. So this is an iPhone with the little notes tab, right? So if you have trouble remembering specifics by the time you go to do your evaluation, just dictate into your phone a few thoughts about each learner several times during the rotation, and you'll have enough to fill out on an evaluation form. And finally, the last part, we have to fill out some numbers. We have to say, where is this learner on this checkpoint? And we all have different scales, so I'm not going to go too much into that, but I'm just going to give some pitfalls to be aware of, okay? So be aware of the halo effect. The halo effect where you say, this person did a great job in their medical decision making, so they must communicate with patients well and the social workers well, and they must be very professional. And you just give them very high marks for everything because of one specific aspect. So make sure that you're evaluating each question differently. The leniency error where it's Lake Wobegon and everyone's above average, and we all know that 90% of drivers think that they're above average. And so make sure that your evaluations don't have everybody above average, or the central tendency error, which is everybody is average, nobody's above, nobody's below, everybody's the same. So make sure your evaluations are discriminated. The recency effect is where someone's done a great job up until the last day when they missed that one little thing, and that's on your mind because it's recent. So when you fill out the evaluation, you downgrade it because of that. So take that small piece of information in the larger context of the entire rotation. And then the similar to me effect. So just be aware. So when I have someone that wants to be a teacher and a general internist and an educator, I need to make sure I'm evaluating them fairly compared to my colleague who doesn't want to be like me. That's okay. We need lots of different types of people, but don't give them high marks just because they're similar to you. So one of the things I'd encourage you to do is an evaluation audit. So we have our residents do chart audits, right, where they go back and they look at how they're doing. So I'd go back and just look at some evaluations that you filled out over the last year and think, if I were a learner and I got this evaluation, would it help me? Do they all say, read more, had a nice face, liked them? Or do they give specific, concrete, tangible ideas for improvement? And then look at your marks of them. Are they all in a straight line, everything the same? Or are some things higher and some things lower? And just do an audit of yourself to see how are you doing on your evaluations. So this is my summary slide. So I think evaluation is really important to keep learners on track to reach their goals. And when done well, I think we can go home and tell our spouses about it. Because I think you can really help someone on their going to their next rotation by really giving them good advice. Have them self-evaluate first. I don't know how to do it without doing that. Give your evaluation and give them that advice. That's really what they want. How do I get better? Use that coaching framework and that coaching mindset, and it will be well received because they will leave saying, that attending cared about me, and that's what matters to them. And then make your written evaluation comments specific and meaningful, and do an audit of yourself and see how you're doing in that regard to decide. And I'm 1 minute over, so I don't know if we have time for questions.
We actually do.
Okay.
Because this is the end, there's actually 15 minutes for questions of any of, Dr. Tracy is here, and Dr. Deek, and Dr. Kraemer, and myself. I think Dr. Marshall had to go to, we have some time just for questions and answers about all the content. So. I actually had a question for you, Christy. So the coaching, what is the actual setting where you tend to do it? I mean, you mentioned like real time. Something happens on rounds and you want to talk through, so something like this. Can you kind of account for that needing to be part of your time, or would you choose to do that?
So it depends on the issue and whether I think that, or whether it seems that coaching comment is maybe even going to apply to a lot of team members. So I focus a lot on doctor-patient communication and plain language, which I will tell you in doing bedside rounds, everybody can improve on. So those kinds of things I do as we're walking as a group or after we leave the room, just kind of do it right there on the fly. Yeah. Sometimes if it's just this particular learner and this particular thing they did or didn't do, we'll huddle back from the rest of the crew, or I'll grab them after rounds for a couple minutes. The residents are usually busy, so I usually meet with the students kind of immediately after rounds or in the afternoon and provide a coaching comment or two.
Yeah, you had mentioned doing it while walking, and I was just curious about the times when it's the receiver, the learner might be more sensitive to the.
And that's a lot of that comes in setting expectations and how you frame it. if you start with them and say, hey, listen team, we are all here to learn. I'm not perfect, you aren't either. You know, I know that you guys want to be the best you can be. My job is to help get you there. And I would never do it about like big emotionally laden things. It's usually like, hey, you said exacerbate. You think the patient knows what exacerbate means?
But I think there is a really important part of finding something that people do well and praising in front of the whole team. And I think that's kind of what you're getting at. And so I did this with my resident recently. On the first day, she was, discussing a plan with the patient. She said, what questions do you have to the patient? And so we got out of the room and I said, did anyone notice one of the things she did really well? She said, what questions do you have, as opposed to, do you have any questions? And we talked about that difference and how great of a turning point it was. For the next 2 weeks, she said, what questions do you have every single time? And so it reinforced it for the next 2 weeks. So catching somebody doing something right and praising in front of everybody really puts that in people's mind as, I'm going to do that. That's important. Yeah.
I think for all kinds of feedback, it really is about learning climate. And one of the ways I do it with the coaching model is even have the whole team coach everybody else. So after someone gives a presentation, all right, what did you hear? Was there anything else you were wondering about? And the medical students will chime in and maybe pick out some things that the intern didn't say or vice versa. And it just sets that tone that, hey, this is normal and it's accepted and it's okay and we're not going to get all like angsty about it.
What success have you had in getting learners to give you feedback or evaluation? Because as you know, I have particular difficulty with that.
It's tough. And the higher you get, the harder it is. It's much easier when you're a peer. I think it goes back to what you set the expectations on, and if at the beginning of the month you say to them some things you're working on. So one of the things I'd like to work on this month is giving you feedback on your notes, because I've realized I haven't been giving good feedback on notes, or I haven't been giving good feedback on this. Help me stay accountable. And then that just lets them know, oh, they're working on things too. And then when you get to the end, they're more likely to give you feedback. If you give the learner a little bit of advanced warning, it's also helpful. So, a couple days before the end of the rotation, say, one of the things I really like is when we talk in a couple of days for you to tell me some things you think I could do better. Then it gives them that time to think about it and come up with something. And then the phrasing that I like to use is, if we were going to work for another 2 weeks together, what could I do to help you more? And so it's not what did I do wrong? What do I suck at? It's what could I do to help you more? And sometimes we get, I don't know, say, well, what was it that you liked that we did that I could do more of? Or what was something that you think I could do just a little bit differently to help the next person more? And sometimes with that phrasing, I get some honest feedback.
One of our pulmonary fellows, when he was a resident, would tell the rest of the team at the start of the month, you have to tell me one thing that I can do better when we sit down and talk halfway through the month. And so he would set it right there at the first so that they were looking for something the whole time that you could do better. And actually, some of us as attending started doing that. We thought it was very effective. He always got feedback on what he could get better at.
I try the start, stop, continue. Tell me one thing I should start doing, maybe that others didn't do, or that would help me more. What's something that I should continue doing because it's helpful, and please tell me one thing that I should stop doing. And I think when you frame it like that, sometimes I've gotten a little more formative feedback, but it's tough.
If you don't set the expectations up front and you don't give them a warning it's coming, you will never get negatives. They just don't. Unless it's really something that they've been waiting to tell you, then
stop giving me.
Yeah, exactly. Every time you kick me, it hurts. Then you won't get it. So you really have to be intentional about it and set it up. It's the same way for giving a talk, right? So if I go to Calvin or Chrissy after giving this talk and I say, how'd I do? They're going to say, great, you did great, thanks. But if beforehand I say, Chrissy, I'm about to give this talk, could you please keep some notes about what you think I did well and what you think I could improve on while I'm giving the talk? The quality of the feedback is completely different.
I think also one of the things I like to do, and I think I developed that over the years, I like to tailor the feedback in a way. I can start the question, especially with the residents. So what are you going to do? And that helps a little bit because, say for example, a resident tell me, I'm going to be a hospitalist, but I will do it, say, in Africa. Okay, we're good. So I'm in Africa, I can tell you some information about it.
Yeah.
And I'm a hospitalist, I've been doing this for 10 years. Right. So here can I tell you a few things, and definitely you can stop by even after the rotation and you can look even more.
Right.
And that, like, tailoring it to everybody helps a little bit and doesn't make it so formal.
Yeah.
And gives them also this window that they can always stop. It's not like I'm just giving you a feedback and evaluation for this 1 week which we're doing right now, for 2 weeks or 2 weeks, whatever.
It's tailored to you because I care about you.
Exactly, and they feel better about it. They can open and you know probably some information about them during this way of introducing the feedback that they have, that you never know about it or they wouldn't tell anybody else. And sometimes it's helpful because out of your experience you may be able to get enough information.
Excellent.
All right, well, thank you to everyone for coming. Thank you,